Kurt, would you like to lead us in the Pledge of Allegiance?
Love to.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone.
Morning.
Welcome to the Shawnee County Board of County Commissioners. It's July 20th, 2020. What do we have? Oh, on my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. Now, what do we have first?
First item is item 2, unfinished business. Number 1, consider authorization and execution of contract C-253-2020, agreement with the Railroad Heritage, Inc. for the lease and operation of the Great Overland Station. County Councilor.
Good morning, Commissioners. Joni Thadani with the County Councilor's Office. This morning we are finalizing or readdressing the lease agreement for the Great Overland Station. I don't know if the Commissioners had any specific questions, but I do know that Bob St. John is here and can help answer any questions in regards to the specific lease agreement that you have in front of you. Otherwise, I do believe that the position was at this time to consider it and ask for approval of that lease agreement.
Okay. Do you have any questions at this time?
I don't have any questions. I've had a chance to review the lease.
I had a couple questions, but you've answered them for me, so I think I'm fine with it right now. But
And I don't have any questions either, so I'll make a motion to approve the lease.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0.
Thank you.
Do we want to do any, just a photo op or anything like that?
I don't know anything about
Not
that.
yet? Not yet, okay. All right, thank you. What's next on the
Item 3, consent agenda.
I'll move for approval.
second? Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk. Number 1, consider all voucher payments, and there are 2 of them.
There are 2 voucher payments as indicated by the county clerk. Our first voucher is for $1,868,191.24. The highlights out of that voucher report, the largest was allocations, which goes out to our charitable contributions in the community. That was $1,196,009.18. The next highest was Capers contributions of $330,267.25. And then finally, through a variety of different expenditures, Parks and Recreation was $115,905.23. The second voucher report was $2,571,253.00. This is a little bit more complicated. Under our building and maintenance, we had $115,042.56. Of that was $46,590 for the Forbes Pro Shop roof replacement. Under bridge, we had $375,849.22. That was for the Bettis Asphalt and Construction for Southeast 29th Street from the 470 KTA to Kuroko Road construction. Under equipment, we had $56,765, and that was primarily for the resurfacing of the pickleball courts at Hughes Park. Under elections, we had $65,895.59, of which $57,949.66 was the printing and postage of the special election letter, letting people know how to vote by mail, by advance ballot. Then we had, under holding accounts, $1,109,932.19. Health insurance premiums of $302,653.24. Public Works had $208,859.62. And then finally, Parks and Recreation, again in a variety of different expenditures, was $97,502.49. I have reviewed the vouchers, I don't have any questions, and would move for their approval.
Second. Motion's been made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I would move that we approve the correction orders.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item B, Public Works, number 1, consider approval of request to transport hot mix asphalt from Bettis Asphalt Construction, Inc.'s Blue Springs Production Facility to undertake a 2-inch mill and overlay project on Southeast 45th Street between Stubbs Road and the Shawnee Douglas County line beginning the week of July 27, 2020.
Good morning, Commissioners. We would like to do a mill and inlay on Southeast 45th between Stubbs Road and the county line, Douglas County line. And in order to get that accomplished, we need asphalt. And by contract, that asphalt is coming from Bettis. And logically, then, the closest plant is the Big Springs plant. So to transport that material along 45th Street, which is logical since the project's on 45th Street, we would need approval from the commission as per Resolution 2009-30. Any questions?
Question? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you.
Herb. Next item.
Item C, Health Department, number 1, consider approval of request to offer a candidate the position of Infectious Disease Division Manager in the Shawnee County Health Department at an annual salary of $83,637, including benefits, with funding from the departmental budget.
Good morning, Commissioners. Linda Oaks from the Health Department. We were fortunate to find a strong candidate for this position. This person has experience in all the computer systems that we need to use, a lot of leadership experience. In order to make this position to where this person could afford to take it, we do need to start them a little higher than the beginning salary. So we are asking to start this person at step 6. I do think we are very fortunate to find this candidate for this position. And I'm really excited to be I'm looking forward to working with them and very excited about them starting with us. And I'd be happy to answer any questions.
Any questions?
I do not.
I'll move for approval.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item C, to acknowledge the budget revisions to the Kansas Department of Health and Environment aid to local grant applications for state fiscal year 2021, and acknowledge Shawnee County Health Department renewal of current universal agreement.
Good morning, Commissioners. Linda Oaks from the Health Department. There are no changes in the agreement this year. The only changes are in the budgeted amounts. And on this chart, you can see what we requested and what we were awarded this year. So our total for this grant is $932,054. We don't have the FEP regional, the Public Health Emergency Preparedness Regional yet. I think it's going to be here any day. So these other grants, we did ask for more than we received on all of them, which is pretty typical for us. We usually try to anticipate our needs and ask for those. So this is the final award. As I mentioned in my budget hearing, we thought we were getting a nice increase in the state formula, and that money is based, it's just an amount given to the health department to use for whatever they want. It's based on our tax allocation and population, and then the legislature had some cuts, and they took that increase away. So we were close to getting it, we just didn't get it. And then this is last year's awards and this year's award. This picture looks a little better, I think. We did get a nice increase in child care licensing. Most of that money does go to salaries, so that's very helpful. You see a big decrease in family planning. Last year was our first year, it was our startup, so we did anticipate a decrease. And of course, we still haven't been able to start family planning. I'm still hopeful we will once COVID-19 gets where it needs to be, where we can free up our staff, but we still haven't started that. And then, of course, with the regional FEP, we have not had that amount awarded yet. So those are the differences from last year. So very workable for us, I think, as far as our programs. And we will be able to make up any difference in our budget. And then this is just the actual awards comparison chart. You can see the red is this year, the blue is last year, and so really pretty close to what we got last year in most of the areas. So this is, again, it's almost $1 million. It's a major part of our funding and funds all these programs, maternal and child health, chronic disease risk reduction, immunizations, and emergency preparedness, as well as that state formula funding. So I'd be happy to answer any questions about this grant and the budget.
Any questions?
I do not have any.
Well, I would move that we acknowledge the revisions.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioners.
Thank you, Linda. Next item.
Item D, Parks and Recreation, number 1, consider approval of request to fill the following 2 positions and any subsequent positions that become vacant as a result of filling these 2. A, County Clerk, Account Clerk 3, you don't want to replace me. Account Clerk 3 at an annual salary including benefits of $46,404.80. B, Voluntary Services Coordinator at an annual salary including benefits of $56,451.20.
Good morning, Commissioners. Tim Laurent, Parks and Recreation Department. Asking your permission to fill both of these positions and fill any subsequent vacant positions because of hiring. We did have a chance to work with Angela Lewis and HR on the position descriptions and be happy to answer any questions you might have.
These aren't new positions, these are just
No,
filling.
sir. These, yeah, both current.
Okay. Any other questions?
I'll move for approval.
I'll second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item D2, considered authorization and execution of contract C-252-2020, amendment to contract C-243-2018 with Tailor Made Company to extend the current agreement through August 12, 2022 for pour-in-place safety surfacing.
Good morning again, Tim Laurent, Parks and Recreation. We're extremely happy with the work that Tailor Made's doing. They do provide all of our safety surfacing for our playgrounds equipment, and the contract does allow for this extension with your approval, and I'd be happy to answer any questions.
Do you have any questions?
Yeah, just, Tim, can you talk to us just a little bit about what our cost is for the pour-in-place? I mean, is it on a set price? Is it on per playground, or how do we do that?
Yeah, I don't have the exact figures on what the actual, like, per square footage cost is, but it is based per project. So it depends on how big the area is. That's really what it amounts to.
A lot of times the depth tends to change depending on your fall height, and then
We're,
to coloration of the rubber matting, and there's
Yeah.
a lot of variables.
to be honest, for the most part, we're doing one single color usually when we do it. And then we're going in before we put the surfacing down and putting a concrete curbing around the area. And then they come in and fill it up with this poured in place, and that's the process.
And then what's our lifespan on the tailor-made?
You know, I think that it depends. For instance, we don't particularly like to put them under swing sets because it tends to wear out relatively quickly under swing sets. But when you do it under just a standard playground piece of equipment, I think you'll get probably 8 to 10 years out of it minimum before you probably need to start doing some maintenance.
I mean, because these are more expensive than putting in wood chips or other substances.
Absolutely.
But wood chips decompose and compress a lot quicker, so I mean.
Right.
I mean, do we do a cost analysis to compare like wood chips and rubberized versus the pour-and-play?
We have not done that since I've been here. We've just, like I said, we're putting the wood chips in under swing sets. We're putting wood chips in under areas that may not get as high usage. And then we're doing pour in place in the more, in the areas that get the more traffic.
Wood chips, you tend to have to top dress them about every year.
Absolutely.
And also, there's ADA considerations that you are addressed by the poured in place.
Tim, this doesn't necessarily mean we have to use pour in place, right? This just means that if we do pour in place, this is the company we're using.
That is correct.
Yeah, okay.
All right. Any other questions?
No.
I would move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you.
Tim. Next,
Item E, Administrative Services, number 1, acknowledge that the notice of budget hearing will appear in the Topeka Metro News on Monday, July 20th, 2020, showing the total of all departmental budget requests and what the resulting tax rate would be if all the budget requests were granted. This is not the actual 2021 budget or tax rate. Public hearing will be held August 3rd at 5:30 p.m. in the Shawnee County Commission chambers.
Good morning, Betty Greiner, Director of Administrative Services, and this notice was published today in today's paper of the Topeka Metro News, and just to repeat what Cindy has already said, but this is just notifying the public that the public hearing for the 2021 budget will be held here in Commission Chambers on Monday, August the 3rd at 5:30 p.m. This is an opportunity for the public to come and express their thoughts to you as commissioners before you really get into the budget discussions. Those budget discussions will begin that next commission meeting on August the 6th, and then we will have budget discussions every commission meeting after that until an approved budget has been voted on. And the budget must be approved by state statute by August 25th. I will also repeat that this notice and these totals that are shown on this notice are all of the requests received from all the different departments, all the different organizations that we make allocations to. This is if everyone's request was met. And it shows the resulting tax rate that would result if everyone received what they were requesting. This is not the actual budget amount or the actual budget rate. This is just based on all of the requests. And like I say, you will start your discussions on what is actually approved on August the 6th. So, do you have any questions?
any questions? Do we need a motion for acknowledgement?
I'll move to acknowledge receipt.
Okay, I'll second. Motion's been made by Commissioner Cook, second by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Betty. Next item.
Item F, Commission number 1, consider appointment of Rhonda Dieters to the Juvenile Corrections Advisory Board, filling a term ending June 30, 2023.
Morning, Commissioners. Tim Phelps, Department of Corrections. Since I serve as the administrative contact for the JCAB board, I just wanted to stand if anyone had any questions about this proposed addition.
No questions?
Yep.
No?
I'll move to approve the appointment.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Thank you, Tim. Next item.
Item 5, Administrative Communications.
Okay, at this time, we'll allow anyone from the public who'd like to speak on any subject, or if we have someone from other departments within Shawnee County who'd like to make any announcements. None?
Go ahead. No, please. I'm going to take longer. Go ahead.
May take a bit. I'm just saying.
I'm not worried about it.
Okay.
Delighted to be here.
First off, Commissioners, Tammy Hunt. I'm just going to, actually meant to bring some tape to put this right here. Just showing you, this is Shawnee County population per 1,000, okay? I couldn't even do this on my computer correctly because the red part at the very bottom would not show. We have on this part, we have cumulative testing for COVID, we have cumulative confirmed cases, then current active cases, current hospitalizations, and the total deaths. And you'll notice lots of blank from population. These places at the bottom, we've done quite a bit of testing. But these two over here, they aren't even close to scale because they would not show up when I did it on my computer to show you the red. So magic marker had to work. So keep that in mind as I'm talking. All that blank space. Okay. Also, I would ask that you listen to the things that I repeat, because there's a lot of repetitive here. We're going to go through a lot of statistics, a lot of data. Okay, starting with July 10th, we had active cases of 323. That means 99.8% of our population is not currently infected. The monitored cases were 333, which means that there's people being self-quarantined. Many of those people have no income. We've recovered 628. The deaths and the hospitalizations, both on that day, remained at 0.01%, which means 99.99% of the population is still doing well. Confirmed cases from testing are now cumulative 964. That means 99.45% of the population has not been confirmed positive. The number of tests that were done has been 15,505. Remember, that's cumulative since the testing began. And that is a 6.2% positive rate, but that is a 93.8% negative rate for these tests. Dr. Pizzino was concerned about the proportional positive rates, and on that particular day it was 13.4%, which he was saying was too high. But I will remind you that's 86.6% negative rate. July 11th, active cases of 338. That means 99.81% of our population is not currently infected. The monitored cases were 348. Again, self-quarantined people, most of them with no income. Recovered, 639 people. Again, death stayed the same as 0.01%, 13 people, which I'm not going to ever discount that death. These people were someone's loved ones, their parents, their siblings, their, whatever. We don't ever want to discount that, and please don't misunderstand what I'm saying. Likewise, the hospitalization. If someone is hospitalized and really struggling, I don't ever want to discount that. So please don't misunderstand that. We did have 3 more hospitalizations on that day, but again, that still means the same number applies, 99.99% are not hospitalized. Okay? Confirmed cases of 990 throughout the entire time. 99.44% of our population have not been confirmed cases. People tested. Again, that was a 6.3% positive rate, and the proportional negative test rate was 90.2%. Okay? That was the day that Dr. Pizzino was correctly saying that it was 9.8% positive, proportional positive test, and that just means how many confirmed cases went up versus how many people were tested. So we were still at 90.2% proportional negative rate. Active cases on July 13th, 373, but that means there are 99.8% not currently infected. Monitored cases were 378, again, self-quarantined people with no income, some of them. Recovered cases of 649, those cases always go up. Deaths were remaining the same at 99.99%, doing fine. Hospitalizations doubled, went from 10 to 20, but that still maintained that 0.01% with 99.99% of the people not in the hospital. Confirmed cases are at that day as 1,035. That means 99.41% of our population have not felt a need well, no, I wouldn't say that, never mind. But their 99.41% are not infected, and they're not confirmed. Doesn't mean they haven't had it, but it does mean that that day they were not confirmed cases. That means 16,184 people was a big jump in testing of 414, but that means that 6.4% of those people, 414, tested positive, 6.4%. Okay, we're still in the 10.9% proportional positive, but 89.1% proportional negative. Bear with me, we do have a lot of data. Active cases on July 14th, 350. That means 99.8% are not currently active cases. Monitored cases, 388. Self-quarantined, no income. Recovered cases, 703. That was a big boost. Deaths and hospitalizations stayed the same at both 99.99% doing okay. Confirmed cases went up to 1,066, but again, there's still 99.4% of our population that have not had COVID at least confirmed. There were 16,473 tests cumulative done, and that continued to maintain that 89.3% of those testings, people are okay. July 15th, active cases, 363, 99.8% not actively harboring COVID. Monitor cases, 391, again, no income for self-quarantined people. We have a recovery numbers of 706. Deaths and hospitalizations remain the same. Confirmed cases are up to 1,082, and that is a 0.6% confirmed. Of our population, people tested at 9.5% of our population tested positive, or I'm not sure what I put there, what I meant there, but 90.5% of our population have not been tested. Okay, we are still now in that proportional positive rate of 5.06. It went down because of the numbers and how they fluctuate. But again, the proportional negative to the testing is 94.94%. July 16th, active cases of 362. Monitored cases, and that is still the same 99.8%, not, of our population is not actively COVID. Monitored cases, 392, again, most no income. 734 were the recovery numbers, that was up 28, and that was good news. Deaths and hospitalizations are still remaining the same. Confirmed cases, 1,109. That is still 99.4% that are not in this group of these confirmed cases. We've tested 17,146 people, and that was a 93.5% negative rate, but the proportional rate was a 92.4% proportional negative. Okay, large numbers of negative on these tests. Active cases on July 17th, 352. Again, we're 99.8% population is not actively COVID. Please don't understand, I'm not saying that 99.8% of our population did not have COVID. It's simply that on this day, that's what it was. They weren't currently active. We do not know how many of our population has had COVID. On that day, monitored cases are 402. Again, most no income. We've recovered 775. That was a 41 boost. That was really good. Deaths and hospitalizations are remaining the same. Confirmed cases went up 31 to 1,140. But again, that's a 0.64% of positive testing. But that means a 99.36% of our population did not test positive, has not tested positive. Back to the proportional positives for the 17,429 cumulative total, it's back up to 10.95%, but it's an 89.05% negative, proportional negative. July 18th, the active cases were 366, same 99.8%, doing just fine. Monitored people are 407. Those are the ones in self-quarantine because they knew someone and came in contact with someone who had a positive case, and so they're self-quarantining. Most of these people don't have an income. We have recovered 780. The deaths and hospitalizations remain the same. The confirmed cases are now 1,159. That is a 0.66% positive rate for our population, but that means 99.34% have not been given a positive test, or have not tested positive or tested at all. So, and the people tested on that day were listed as 17,682 cumulative. And we finished these last 10 days with 10% of our population has been tested, and 90% have not tested, okay? Now, Dr. Pizzino had indicated that there's only symptomatic people being tested. So what that is saying is these 90% of people could have no symptoms. They may have already had the virus and just got through it, as most people do. We just simply don't know. But they have felt no need to go get tested. Then we have, assuming only the symptomatic people are being tested, some with only one or two of the symptoms, because that's now the criteria is maybe one, maybe two symptoms. The large percentage of negative tests, which is 93.45% of these tests being given, are negative. That could indicate there are additional viruses that are allergies. We're in Kansas. There's a lot of allergies going on that deal with these same symptoms. We cannot negate the impact of stress on people. Many of these symptoms can be stress-related. And we don't, there's several other situations that could be causing similar symptoms. We don't know why there's such a high percentage of negative other than those things, but there's also the possibility of inaccurate tests, which has been well documented. Okay, so my points here, July 8th through July 18th, it's 10 days. In that 10 days, 184 people recovered. Why isn't that being shouted to the rooftops? Where's the celebration for those 184 people? 10 days, 184 people go up and going again, and nothing is heard. Not an encouraging or uplifting word anywhere. So, as a recap, I find these numbers, which you all have, everyone in this community has access to these numbers, and all it takes is a simple calculation. These numbers are very, very far from the dark picture that's being painted. Remember, the epidemic mortality rate is 5 to 7%, and at 5%, Shawnee County would have had to be considered an epidemic, would be 8,800 deaths. That would be horrific, absolutely. We have 13, which is not anything to sneeze at. I understand that. Okay, positive case numbers were expected to rise when we opened up. We all knew that. Everyone is in agreement with that. It's been talked about since March. But again, the goalposts keep moving. We could realistically be at the current 0.01% for deaths and hospitalizations for an entire year, with the 99.99% of the people healthy. Do you expect those same limitations to be in these same limitations to be in place that long? Where is the end to this? I have never heard an end. What is the expectation? Because every time we think we're there, we've got it moved. These numbers that I have repeated to you, they're not alarming. But but are being used in such a way as to instill fear in our citizens. This is akin to calling fire in a crowded auditorium, purposely instilling panic in people. It's fear tactics, fear-mongering, panic pushing, whatever you want to call it. But it is clearly purposeful because the numbers, the data does not back up what is happening. And if that's not enough, all the fear and the panic that keeps going on in our community, from the top down, we have to deal with the threats of fines, law enforcement and arrest, lockdown and house arrest, shutting down the economy again, and blah, 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 anything that they are going to say to gain obedience from the people. Apparently, data is irrelevant because I have just showed you data. It is not matching up. And if that's not enough, our governor has now resorted to belittling. She says counties aren't capable, individuals aren't capable, and our governor, through county commissioners and citizens under the bus all across the state. She didn't pat commissioners and health officers who've been heavy-handed on the back. She lumped everyone together and said she had to take charge because everyone else was incompetent. Things were not working at the county level. I would be offended if I were you. I am offended on the whole thing. So according, again, and she did that for the schools. But according to the CDC, 3 children, have died after testing positive for COVID. However, even the CDC is not willing to state that COVID-19 is the sole cause. Not one child has been attributed sole cause of death, and there's only 3 of them, to COVID-19. Again, data seems to be irrelevant. It's an agenda. And I'm saying enough, absolutely enough. This data does not support the narrative in any way, shape, or form. As to the unreasonable mask mandate, and it is unreasonable because you can look at the data. Modern Healthcare in the July 13th issue, so this was just released this week, used numbers tracked by COVIDExitstrategy.com and states where the mask mandate were in place. Yes, they had a rise in cases, but it was only a 0.2% rise in ICU occupancy. Okay, so masks are not going to change our hospitalizations hardly at all. That's what they're saying. We all knew we were going to have more COVID going around if we didn't wear masks. We got that. We were told that. We knew after we came out of our houses that we were going to have COVID. But masks is not going to help us in the long run. And I would say, how dare you presume to know what's best for the personal health of any individual outside yourself? For you, mask wearing may be a simple thing, but for someone else it may mean a compromise to their own health, physically, emotionally, or both. There are quite a few situations, both medically and in the mental health area, where it is not prudent to wear a mask for many people, and you don't know someone's story. But you've made it exceedingly difficult to even buy groceries for those people. Again, the data does not support that agenda. It does not. Requiring individual people to wear a mask that could be laden with bacteria is a recipe for disaster. Cloth masks, people aren't washing them that often. They're harboring bacteria, viruses going freely in and out of all these masks. And that bacteria is going to cause a problem for many people. And we've already got a problem in our country of the bacteria that resist antibiotics. We're asking for trouble, masking everyone up for months on end. The data does not support any of this. There's also now a snitch line, so that people are encouraged to be legalistic and turn like lions on anyone who doesn't conform. Is that an American ideal? Not in any way, shape, or form. That is something that happens under socialist and communist governments. Are we now in Nazi Germany where we have our people turning on each other? That is not okay. And this is all for what? It's not about health because the data does not support that. There's no data that supports what is going on. As of July 18th, there were over 400 people self-quarantining because they might get COVID due to exposure. They might. They are sitting at home, no symptoms, some of them without income, simply waiting. So my point is, if masks work as well as we're told they do, why can't those people who have no symptoms put on a mask and get back to work? Could that be an option for them? If masks really work like we're told, that should be a good option. It should be a viable option, instead of having 400 people without income sitting at home. The hospitals, Dr. Pizzino had mentioned the hospitals are concerned because of so many staff in self-quarantine. If they have no symptoms, why can't they work again? If the masks work, they should be working. Why can't they work with COVID patients? If they're thinking they might have COVID and they're working with COVID patients, I don't think there's any risk of anything. You know, they're not going to pass on something to somebody. But the reality is, in the hospitals, the N95 masks and all of the other protocols are better than what everyone else wears. So if we're safe as the general public wearing a mask, then there should be no problem to the staff at hospitals. This should not be an issue. There's a double standard going on here. The reality is that we've likely all been exposed at some point, probably several times, and many of us have probably had COVID and didn't even know it. Most of us are just fine, as in 99.99% of us are just fine. You can't have this mask thing both ways, gentlemen. It's not right to tell asymptomatic people they can't work and must stay home, but mandate that everyone else must wear a mask and go about their business. That makes no sense. Absolutely none. Masks either work or they don't. Stop the double standard. Stop the nonsense. And enough with all of the gloom and doom. I just encourage you, look at the data. It's clear. Enough with the negativity. That's all we hear. All the latest panic, all the latest fear inciting information. Stop with the negativity. Look at something positive from the positive way. 99.99% of us are doing okay. And that's proven in the data. Enough with the unreasonable mandates. There's no reason for this mandate. We don't even begin to qualify for this mandate. The data is not lying. I'm getting the same data that is provided at the health department for every person. Bottom line here is we need to stop wagging the dog. The data speaks for itself. And gentlemen, you have an obligation and a responsibility to your community to use the facts, the data that is available to make these decisions and to stop over-mandating and overreaching the authority that you should have. Do you have any questions or comments, gentlemen?
Thank you, Tammy. I would just say I agree with a lot of this, because I run the numbers all the time. And we have been fed this apocalyptic narrative since this whole thing started,
Yes, sir.
and the numbers just don't add up.
No, they don't.
We have crippled our economy for what? For what? And I hate the snitch line. I hate the fining, the threat of fining people. I don't think anybody's been fined yet. But I find it offensive. And I couldn't agree with you more. With a virus that's over 98% recoverable, it doesn't affect kids. You can't find numbers from kids from like 5 to 17 where they doesn't affect them.
No.
And yet we're talking about rolling school back or doing virtual school or whatever. I've always said protect the vulnerable, let the rest get back to work.
I agree, sir.
But Yeah.
Yeah,
I think people know how I feel about it.
yes.
Any other questions, comments?
Commissioner,
Yes.
the numbers that Tammy Hunt reports are her numbers and her statistics. She does not have the background as an epidemiologist. You've already had her chance to talk, but I think we have to look at the whole picture in public health. Anything we do that can help protect public health, we should look at doing. Shawnee County is not an isolated island among itself. This is happening across the state and across the nation. In fact, the news today read that the White House was recommending Sedgwick County go to more enforcement. So if it's good enough for the White House, which you support, why shouldn't we be following that lead? Seems to me that we should be looking at public health as a holistic approach, and what do we need to do to get better and to get back to work? So, that's my opinion.
Okay.
May-
We seem to even be more restrictive than the governor at the governor's plan at this point. I don't understand that. And
Could I say something?
you have to come to the podium.
May I have one response?
Just one
one.
response.
These are not my numbers. And it does not take a rocket scientist to take numbers off the Shawnee County Health Department and calculate them. They're not my numbers.
But to be able to say that bacteria spreads through mass, that they're not healthy, that their bacterias are gathering there, when you have your degree and you bring it to me, then I'll take that as your proof.
I can pick the numbers, and I'll be here next week, next Thursday. I'll find numbers for you. I don't have to have a degree to find those numbers and calculate.
Yes, ma'am.
I don't have much to say, but
I need your name.
Leanne Vanderputten. I'm a mother of 11, and I have 35 grandchildren and counting, and there's nobody who cares more about the health of my family than me. And I don't believe that it's the government's job to protect my health. It's the government's job to protect my constitutional rights. It's my job to protect my health, and I will, and my children's health. When you trade liberty for safety, you end up losing both. That's all I have to say.
Okay. Anyone else wish to speak? Jim?
Joseph Ledbetter, I wisely stayed out of that crossfire. And I guess I better wash my mask, so. Whether that data is correct or not, I think I probably better listen to it. So, what I'm here to talk about, I don't know that I can come back at 1:30, I'll see what I can do. But I am on the Parks and Rec Advisory. These are my comments alone, but they certainly are my comments. And I will stand for questions in case there's anything that wants to be said, because everybody knows I like to debate, and so that's fine. On a topic that's not related but is related, I would like to see the county overall have some retirement incentives. I think that turnover is good in public organizations, and that's not a put down. I think it's okay to let people retire. They've done long service. I don't know why you can't give them a bonus and let them move on if they would prefer to, especially if they're afraid of COVID or whatever. We're going to do that at the Topeka Metro. It was actually my idea to bring up that as part of our budget. And we want to allow people, if we can come up with a plan that works, to have some early retirement, and they may not want it. But I know that right now the city is offering it. I think they should have been offering it for years. I think it's a good management tool. Everything needs pruned from time to time. And I think that they had one 10 years ago, but then they hired everybody back. Not those people, but they filled their numbers back up, so it didn't really have an effect on their budget. But I think that it's time for them to look at it. I think it's time for the county to look at it. If we have school teachers that are afraid to teach, that are elderly, maybe they need to be offered early retirement incentives, because I personally, with grandkids and other kids I'm affected by and concerned about, I want them back in school. Kids have to have an education. And without an education, I think we've actually got some case law, that's a liberty right. So, haven't been to law school. Okay, so now I want to talk about Parks and Rec. I think it was wise to go ahead and take the station today under a lease agreement. The purpose of me offering that lease agreement a few weeks ago as kind of a circuit breaker, kind of compromise to get us into the game and yet keep us from being committed to that moment, taking over all that property. The purpose of it was to have time to make sure we keep that board engaged, because we have to have those contributions. Parks and Rec does not have $350,000 to operate that station. I told Tim that I thought about 150 was probably all we could manage, and we have to have that as an addition to the budget. We cannot take from the current budget and expect that station to be operated. I think that we've got to look at Spectre, possibly looking at it. We've got to look at a NODO with some kind of possible arrangement to help operate it. I personally am concerned that I don't think Parks and Rec has the capacity at this time to operate that, especially asking for $350,000 to operate it as was. One of the big concerns I've got about the Overland station is I don't think you should self-insure that building. I think it's a unique building, and I don't think you want to be stuck with that bill if we had to rebuild that if there was a catastrophic event. I think also that the income from the numbers we got at the advisory had dropped to $20,000 in 2019. Now, the contribution stayed up because they have a good board. But without that board, I don't think Parks and Rec has capacity to raise that kind of money. I am concerned that long-term what we'll do is we will take from other programs and other things that we need in Parks and Rec and drain that budget even further on maintenance. We have to have maintenance. We're still about $10 million short deficit on maintenance spending with Parks and Rec. Just for one of the statistics we've got 155 roofs. Just without catastrophic events, you have to replace roofs about once every 25 years. So every year we need to be replacing roofs. Every year we need to be repairing a lot of plumbing. We've got, I think, well over 100 restrooms in that Parks and Rec system. We've got community centers that need to be maintained. But more importantly, in my opinion, we have got to start rebuilding our playgrounds. The playgrounds are where the kids keep from becoming obese. The playgrounds is where they learn social interaction and have fun. And when school's not open in the summertime or when the schools are closed, they can go to the local park with their parents or relatives and have a good time on playground equipment that costs us basically nothing to maintain for years, costs us nothing in utilities, costs us nothing in personnel. It's probably one of the wisest things you can do in Parks and Rec is build up these neighborhood parks. And some of them have been sorely neglected. Seabrook, Country Club, some of these I have personal knowledge of because I live in those neighborhoods, or I have friends that live in those neighborhoods, and their kids have nothing to play on, and yet there's lots of kids in all of those neighborhoods. It is an easy way to make Parks and Rec spread its value across all the neighborhoods and across the city in a much more even pattern than just trying to concentrate $8 or $10 million in one park at the western edge of the city. And that is why you had such a lashing back of the public on the the last proposal for Family Park was because so many people were fed up that the neighborhood parks were not being taken care of, in their opinion. And they are entitled to their opinion. They are taxpayers, just as I am. I believe that maintenance, when we take maintenance away, we're actually destroying facilities. We're not maintaining. When we're not maintaining what we're doing, I sent an email to you. I don't know how many of you read it. But I said it's kind of like a dime stopping a dollar. If I don't do maintenance on my vehicle, whether it's brakes or oil changes, I may have a catastrophic wreck. I may have a $5,000 repair bill on an engine that I could have prevented for $50 of maintenance. And I will give you some for instances. We've got Snyder Cabin that we rent over in Gage Park. I asked for the gutter system to be replaced because that gutter is allowing water to leak all over the siding and the paint. That has a catastrophic effect on a building when you don't replace the gutter systems, and they're not that expensive to replace. I've seen roofs in different parks that need replaced, and I realize that when you don't replace them, what you have is water coming in on those facilities, potential for mold, and things that are a lot worse than just that simple roof repair. Parks and Rec has about 2,000 acres. We have multiple facilities. We shouldn't shy away from that. We should be proud of it and actually maintain it. I never want to see any government, no matter which it is, and this is not just talking about Parks and Rec or even county government, I don't want us to be slumlords. If we own a building, let's take care of it. And if we own facilities, let's take care of it. And the people will support you on that. There's a huge support for Parks and Rec, but there's not a support for concentrating bonds or the wealth in just one or two parks or one or two areas. If you want to make the people proud of this park system, and a lot of them are, we need to spread that out. We need to make sure that we're taking care of flower gardens. We need to make sure we're taking care of playground equipment. And under the contract, which I like to refer to every now and then, we were to upgrade and maintain our facilities, not tear them down, not sell them off. It was very strong words in that contract between the city and county that we were to maintain what we took over. And so there has been movement that's positive, so I'm going to address that. We did get $3 million about 2 years ago for deferred maintenance. To my knowledge, it finally got spent. I think it was still sitting around last July, but the new director got on it, and I think all of that pretty much has been used. And one of the key components that I see in Parks and Rec is we have to have maintenance money. And maintenance money would include upgrades. That means rather than try to patch a heat system that's 30 or 40 years old, I replace it. That means that instead of patching a roof all the time for 10 years in a row, I actually replace it. That means that playground equipment that's 40 and 50 years old, eventually you do upgrade it. Now, I will tell you, I've seen some playground equipment that as long as it's painted, it's still working 50 and 60 years later. So one of the things that I do believe investing in, and I've said it already, is playground equipment. It tends to last, and the kids are not that hard on it. And I think that it's a health benefit. It's a mental health benefit to kids to get to play. It's a mental health benefit to their parents to let them go play. And so I do strongly believe in Parks and Rec, but I do want to tweak it that we have got to put money into our parks, into our playground equipment, and a lot. We need to play catch-up here. Under the plan that was adopted a few years ago for Parks and Rec, we were supposed to be upgrading anywhere from 5 to 7 per year. And even though we had 12 upgrades, there's still a huge amount of parks that have not been upgraded with playground equipment. So I think I've said all I need to say at this moment about this, and because I know you sometimes have questions, I'm going to stand for questions and be happy to comment on comments.
Any questions?
Not this time.
No, I have none. Thank you, Joe.
Thank you for listening. Appreciate it.
All right. Anyone else need to speak? All right. What's next?
See if the commissioners have them.
Oh, Commissioner Mays, do you have any comments?
No.
Sure. Well,
There's a lady.
oh, we have one other person? Okay.
Good morning. Ivy Lagrone. I am going to talk about the subject of masks, but not just masks, basically the policies that have been kind of implemented from this office to the community at large for the COVID response. There's obviously lots of different opinions about the effectiveness of masks and whether they work well at, reducing the spread of the virus and things. And I think that you could bring forth information that says that other experts, they don't agree on that. There's many, actually, that don't agree on that, and I could bring that to you if you really want it. But I just want to establish that because I think it affects what I really want to bring toward the commission today. And that is, I'm really very concerned about our community. I'm concerned about the division. I'm concerned about this destructiveness of people at each other. The level of stress that's out there is unbelievable. And some of the policies that are being implemented, I think, add to that. I don't think they detract from it. I think they add to it. And what I'd really like to know from you all is, what would you ultimately like to see in regard to your relationship between this commission and the health department and the community at large? What would you really like that to be? I mean, if you were able to define what you would like the relationship to look like, what would you define it as? I mean, that's an actual question I would like to know from each of you.
I'm not sure I understand your question.
If you defined your relationship between how you would want the interaction between your offices and the community at large to be, how would you define it? Do you want it to be collaborative? Do you want it to be, hey, they just listen and take care of business the way that you think that they should? How would you want that to be defined?
Take the advice of the public health officer who's trained in his field. Take the advice of the people that are trying to protect the health and community to get us back to a spot where our businesses are open. So it is going to be partially collaborative. We do work with businesses to try to adhere to their policies and procedures, understanding where they're coming from so that we have public health and public business interacting.
Okay.
I think, I agree with a lot of that, but I think too, when you have a pandemic like this, that maybe it should be in more than the hands of one person. I mean, we have Dr. Petzino, but there are other experts in the field, other medical doctors, people who are experts in that exact same specialty. And maybe something as big as this, maybe we should have a group of these doctors that help make the decision. You know, when you have something happen to you, health-wise, you a lot of times go get a second opinion. And most good doctors, they don't have a problem with that, because if another doctor says the same thing, it reassures them they made the right decision. If they made the wrong decision, they can learn from that. So, I look at this and I think sometimes maybe we should have more than one expert, because it's a huge effect on this whole county, this city. It's enormous. And for that to fall on the shoulders of one man is quite a responsibility. So that's my thought on it.
Okay, thank you.
I guess I I'd like to stop seeing this as a partisan issue and see this as a public health issue, and that we stop being so set in our ways and listen to both sides of issues and form educated decisions and not necessarily seek out answers to our opinions. I feel like whatever your opinion is, you can probably find someone on the internet that agrees with you now. You can also find 100 others that disagree with you. It doesn't mean that one is right and the other is wrong. There's probably some truth in between them, and I'd like to see this be a little more cordial, is what I'd like to see.
That'd be excellent. Okay, that's fine. I guess what I'd like to really present as something that I'd like to see is that every time a policy is made, particularly on this very heated issue, is what the policy, is it going to promote a sense of unity in the community? Is it a collaborative partnership effort between this office and the people in the community? I would actually posit to say that the some of the current mandates, particularly the mask mandate, is actually promoting disunity and a lot of, just some really ugly things. I'll just give you an example of me personally. My daughter has a medical condition. She cannot wear a mask without it being a significant blow to her health. But she has been accosted 5 times by people in the community. And that did not happen until the mask mandate came out. And she has started wearing one at the detriment of her health because she simply is terrified to go out in our community to just do regular life. And she's 20 years old. A 20-year-old should be able to go out into her community of neighbors and friends and family and feel safe. And I feel that, I'm not saying that, you can't strongly suggest that there's masks, et cetera, but I do believe there should be a lot of more communication from this office saying, hey, listen, don't turn on each other. It's not that kind of situation. That is not healthy for a community. A community should be a group of people who are unified together, and that is not what we're seeing here. I totally agree that you'd like to see less, what did you say the word was? I don't remember. Anyway.
I don't remember.
It's okay.
I didn't write it down, so.
It's okay. So what I'd really like to see is, one of the people who had been so unkind to my daughter was with a business, and I asked them, I said, hey, what's going on? Because I just thought that was not really okay. And they're terrified they're going to get fined from this department, the health department. They're terrified. Our businesses shouldn't be terrified of the people who are overseeing them and the health of the community. That cannot promote health, mental or physical or otherwise. So I'd really, really like to urge you to, whenever you consider a policy, even if you think that possibly it could help in the effort to reduce the spread of COVID, what other kind of effects does it have? And if it's going to have those negative effects, what can you do about it? I mean, if you're going to mandate it, why don't you have Dr. Pizzino or whoever stand up here and say, listen, do not attack each other over this. There are people who have a valid reason to not be wearing a mask. Do not attack them. That is not what we want in our community. That is not healthy. It's not okay. And I'd really like to encourage you to contact local businesses personally and say, hey, what's going on? Are you really terrified of our health department? What can we do to improve our relationship with one another? We don't want that. We want to promote something different. Those are the 2 suggestions I have specifically on that issue. I could give you lots of other information as to why I believe that that does promote health in our community, but I think that you probably kind of get the connection. Do you guys have any questions?
No.
I do know that I go out to eat quite a bit because I'm trying to help restaurants, and I usually I try to talk to the manager every time I go in. I said, are you getting information? Are you getting the rules? Do you understand them? And I'm seeing a lot of confusion. yesterday at a place, and he said, you know, I work back in the kitchen, and he's the manager, the owner. He says, I work back in the kitchen. I've got a mask on. He says, I'm about to pass out back here wearing this
Yeah.
mask. He says, I'm not interacting with the public, and yet he's made to wear the mask. He says, I can't afford a $1,200 or $2,500, whatever the fee or the fine is. He says, I can't afford that, and he's afraid of it. I talked to another person at a pizza restaurant, and they were very confused about this hour of deep cleaning, and when are we supposed to do that and how, and they didn't know. They hadn't gotten the information that we had changed that mandate or that order. And so I don't think the information's getting disseminated out there, what people can and can't do. And I think there's real confusion as concerning what is social distancing and when you can use it in lieu of a mask. I see people out jogging in the park with a mask on, and they're by themselves, and I'm thinking, really? That's probably not good for them. And who are they saving? What are they doing? I think there's just some common sense that goes with all this, and but I do think we have a little bit of an issue with restaurants and businesses getting our information out. We need to do better at that. Any other comments?
Okay, thanks.
Thank you, Ivy. All right. Anyone else? I don't think we have a need for an executive session, so we are adjourned, but we are going to start budget hearings immediately. We're a little behind schedule, so we'll start in about 5 minutes.